In North America, atrial fibrillation, a type of arrhythmia, affects about 2% to 3% of the population and has resulted in 112,000 deaths in 2013, an alarming increase from 29,000 in 1990. Sudden cardiac death is responsible for about 15% of deaths globally, and about 80% of sudden cardiac deaths are the result of arrhythmias, proving that arrhythmias can be deadly. Although alarming, these statistics prove why there must be a drug in place to reverse the role of cardiac arrhythmias. For this reason, we are going to talk about lidocaine today.
Lidocaine is an antiarrhythmic drug used to treat these cardiac arrhythmias during cardiac surgery. It helps eliminate cardiac complications during surgery. The chemical formula for lidocaine is C14H22N2O.
Before we get into how lidocaine works, we must understand how cardiac arrhythmias occur. Our heartbeat is triggered by electrical impulses that travel down a special pathway through the heart. First, the impulse starts in the sinoatrial node of the right atrium, also known as the heart's natural pacemaker. Then, the atria contracts. The electrical signal slows down as it passes through the atrioventricular node and enters the ventricles along with the blood. The signal is sent to the Purkinje fibers, which causes the ventricles to contract and blood is forced out of the heart. If the electrical signals to the heart are not working properly or are interrupted, an arrhythmia will occur.
Arrhythmias are when the heartbeat is abnormally irregular, slow or fast. These can be detected with a simple reading of an electrocardiogram. However, if left untreated, arrhythmias can lead to a stroke or heart failure. This is where lidocaine comes in. During cardiac surgery, patients are administered lidocaine to prevent or control cardiac arrhythmias. Lidocaine is a class 1B antiarrhythmic drug that is used intravenously to treat cardiac arrhythmias occurring during general surgery, during and after cardiac surgery, and following acute myocardial infarction.
This drug binds to and blocks the fast sodium channels that are responsible for the depolarizing phase in contractomyocytes. Lidocaine blocks sodium channels in the SA node, AV node, and mostly the Purkinje fibers, as well as the muscle cells of the heart. The result is a slower depolarization with a smaller amplitude. Slower influx of sodium results in a smaller flow of positive ions through gap junctions to adjacent cells. The adjacent cells take longer to reach the threshold required to generate a new action potential, ultimately resulting in a slower propagation of action potentials through the myocardium. This reduced conduction velocity helps to suppress formation of re-entrant circuits, hence the use of lidocaine to treat re-entrant tachycardia, a type of arrhythmia.
How is lidocaine digested? Drugs and medicine go through 4 different steps for digestion: absorption, distribution, metabolism, and excretion. Step 1. Absorption. Injection can be one of the fastest ways for lidocaine to reach body tissues and organs through the bloodstream. Injection into the vein, or intravenous injection, delivers lidocaine directly into the bloodstream. Step 2. Distribution. Once lidocaine has entered the bloodstream, the heart pumps the blood throughout the body, carrying the lidocaine with it. The blood arrives at the heart where lidocaine does its job. Step 3. Metabolism. Once lidocaine has finished doing its job, it is broken down, or in other words, metabolized. Lidocaine is about 95% metabolized in the liver into the active metabolites monoethylglycine xylidide and then subsequently to the inactive glycine xylidide. These metabolites and lidocaine travel in the blood to the kidneys, where they are turned into urine. Step 4. Excretion. Once made into urine, lidocaine travels down into the bladder, where it is stored until it is excreted. Lidocaine is extensively metabolized by the liver. Its clearance and excretion heavily depends on liver enzymes. Lidocaine clearance changes with liver enzyme inducers and inhibitors. Cimetidine and amiodarone and fluvoxamine decreased lidocaine clearance. Mexiltine and phenobarbital increased lidocaine clearance.
During surgery, patients are constantly monitored with an electrocardiogram. When lidocaine is administered, the positive feedback from the ongoing cardiac arrhythmia, which could be an irregular, fast or slow heartbeat, is interrupted and therefore stopped. Once lidocaine does its job and stops arrhythmia, the ECG should normal peaks and valleys in PQRST complex as the heartbeat will now be normal. Side effects include high blood pressure, swelling or redness of the skin at the site of injection, constipation, nausea and or vomiting, confusion, dizziness, headache, tingling in the toes, fingers or hands, changes in heart rhythm, methemoglobinemia, malignant hyperthermia, seizures, anaphylaxis, baldness, and dizziness.